Hello, and welcome to Timing is Everything, a program of Care Dimensions. My name is Mary Crowe, Director of Professional and Community Education at Care Dimensions, and today our guest is Kristin Kowalski, who is the School and Community Outreach Specialist at Care Dimensions.
Hi, Mary. Thanks
Kristin,
for having me.
oh, so happy to have you on the show today.
Thank you.
So this is really an important topic.
It is.
You know, so and I think it's a topic that just doesn't get addressed enough. So we're going to talk today about grief in the school systems, and for children and in the school system. So before we get into that, Kristin, tell us a little bit about yourself.
I've been part of Care Dimensions since 2010. I've done group work with adults and kids. And for the past 5 years, I have been the group facilitator for the Young Widows group. We do about 4 8-week sessions a year.
Great.
Yeah, so
Excellent.
I've had my hands in everything.
Yeah, that is wonderful.
Yep.
So tell us more about this school and community outreach position that you do.
So it was recently a new position. It started at the end of April. The Burton Center found that they were getting phone calls from schools in a crisis situation. So a student died, a teacher died, and the staff would rally around and help support the school. And then they thought of, well, what if we get in there before and do grief education for the schools, for the students and the teachers. So this position was generously supported by Donna and Henry Burton.
That's wonderful.
Who the building Burton Center is named after.
That's fabulous. Yeah, just so necessary.
Yes.
You know, can you talk to us a little bit about kind of the unique differences? Because certainly children grieve differently than adults, don't they? So talk a little bit about that, if you will.
Children grieve developmentally. So how a 4-year-old grieves is differently than a 16-year-old. And families often have a difficult time when they're grieving themselves, how to best support their child who's grieving. It could come out in behavior, it could regression, taking some risk-taking behaviors, and when you get into the schools, it comes with academic decline, behavioral, social and emotional. So there's many different, and kids grieve at each developmental level.
Yeah. It's, you know, I think that's important for people to know, right? Because I think sometimes we're thinking that they're going to grieve in the same way we are, and that we're, you know, they're going to be able to sit down and talk about their feelings and express it in that way.
Right. We get phone calls all the time, especially in that school age, teen age range. My children seem okay, but they're not talking about it. And our response is, it's okay. It doesn't mean they're not thinking about it. As long as they have some healthy coping skills, and you don't see any drastic changes, it's okay. You know, just let them know that you're there to talk if they want.
Yeah, and a lot of times too, you're talking about developmental stages because, you know, children, like I said, they're not doing the 50-minute hour thing, are they? So then a lot of time you can see, or you can do grief work through play.
Through play and through drawing.
Exactly. So which is really important.
And just even playing Candyland.
Yeah.
You know, it doesn't have to be a grief-related activity. It can be as simple as Candyland.
Yeah.
And
isn't it amazing?
Yeah, as long as you're given the space.
Yeah. Yeah, I remember years ago when my daughter was young and her best friend, her father was killed in an accident when he was riding his bike. They were doing Playmobil.
Yes.
And they actually started talking about the accident and the incident by doing that. And I can remember wanting to go, I was about to step into the other room thinking as a social worker I need to intervene. And it was like, no, they're doing just fine, aren't they?
Yeah, and then put kids together who have a similar loss.
Yeah.
And it's incredible to watch because they're with other kids that they get it.
Yeah, you know, and it must be sometimes, because it must be so hard, right, from both perspectives. So you have a child who's grieving, and sometimes, like you say, it's coming out behaviorally, and it's aggravating, right? So then we label it as just bad behavior when actually there's underlying grief going on.
Right.
But from the parents' perspective or the adults, they're trying to grieve, and then they're trying to manage the grief of the children too.
Right.
Wait, that's a handful.
It is a handful, and that's where the Burton Center has resources for children and families. We have our children's groups. We have, it's called Raising Grieving Children. So the kids are in one room doing activities, like memory making activities, and then the adults are in a different room with a facilitator. We offer individual counseling for kids
That's
as
nice.
well. Not, and the family didn't have to go through hospice services.
Which is really important
It
too
is
that people
important.
know, right?
It is
Because people
important.
assume that in order to utilize the grief support through the
Yep.
Burton Center, you have to have been part of the,
Nope.
and you don't at all.
You don't at all.
Yeah,
You don't
that's
at
good
all.
to know.
Yeah.
Yeah, and I think that people aren't aware of the multitude of resources that are out there, and certainly we do a great deal with child life specialists
Yep.
and all of that
Yep.
through. So it's important that people know
Yes,
that
yeah.
because I think people are, they're so immobilized by grief that they don't even know who to turn to.
Right, and they just want to know that their children are okay.
Yeah. Yeah.
And that's the biggest thing
Yeah,
for them.
absolutely.
Yeah.
Talk about, how does this manifest itself in the school system? This is hard.
It is hard. It is hard.
These major events in your personal life, and then you got to go to school
Right.
at a time when, where you're talking about developmentally, kids their identities are developing. All kinds of
Yes.
stuff is happening.
Yep, and they
Talk
don't want to
more.
be different, and
Yeah.
they don't want, they don't want to stand out. So what we recommend for families, if a death occurs, that to call the school.
Yeah.
That, especially if it's during the school year, is to call the school, let the principal know, let the guidance counselor know, and then have a conversation with the child and the school about how the child wants it to be when they return.
Yeah.
Some children want those 6 hours to be a place where they can go
Yeah.
and not be reminded that their loved one has died. Other kids would like the attention.
Sure.
They, so whether it be, the classroom teacher announces something, but even the classroom teacher and the principal can have a conversation with the class about how Joey wants it to be
Yeah.
when he returns to school.
Sure.
And just letting the child who's grieving know that the school knows, and if they need to get up and remove themselves from the classroom, they're given that permission.
Yeah.
Because oftentimes with some kids, if school's difficult on a good day,
Yeah. Yeah.
and they're sitting in math and they don't want to be learning how to do their times tables, they start thinking about possibly the person who died,
Yeah.
then the tears could start.
Sure.
And then if they don't know they have that space to get up and walk out,
Yeah.
then the secondary, they're feeling like they're being made fun of because they're crying in class. So, yeah.
That's
just-
a big chunk of time that they're in school.
It is a
right?
big chunk of time. It is.
And how isolating it can be.
Right, right. And if the children want to return to school, that's a
Yeah.
big thing. To let them return.
Yeah.
If they need a couple days off, that's okay too. So for the parent, the surviving parent, they're like, why would they want to go to school?
Right.
Their dad just died.
Yeah.
They want their life to continue.
Yep. Well, and that's the interesting part, right? There's
Yes.
the dichotomy there because
Yes.
one of our tasks of grief is to get back into life, even though it's going to be different.
Yes.
But it's what a struggle in terms of not knowing where is going to be helpful, right?
And kids often have a better job than adults do.
Yeah, isn't it
about
interesting?
getting themselves back,
Yeah, with the resiliency and all.
Yep.
But but here they are, and they, even like now, here we are in the summer, and they can have do you see that it's different sometimes? Like they have an experience where they maybe in the summertime they have the significant loss.
Yes.
And then how do they re-enter the school system?
Right, because life has drastically changed
Yeah.
since the last day of school.
Yeah.
And that's again, having a conversation with the school, because the beginning of the school year is always that fresh start. It's a new beginning. Well, for families who have suffered a loss, there's this new beginning, this great new beginning is happening when someone's not going to be able to be there for it.
Absolutely.
And that can be very difficult, that re-entering into school.
I think it should also be, or must be difficult because here they are, they go to school, and if the teachers are not aware of this, then again, they can be frustrated with a
Right.
kid because of
Yes.
behaviors,
Yes.
this, that, and the other thing,
Yes.
and just attributing it, they can be sent down to the principal's office, all
Yep.
kinds of stuff,
Yep.
when there's this underlying stuff going on.
Right. Because if the school hasn't been informed and the child's not saying anything,
Right.
the teachers are only going by what they observe.
Yeah.
They're not going with the knowledge. In this way, a teacher can kind of look at how they respond to grief
Yeah.
and how they handle it and how to best support the student. Because if they have a hard time dealing with grief, they need to get some education or do some work on how to support that child.
So what are the challenges that you see? Like, because we're talking about, so how do parents help their child? But when the kids are at school for a
Right.
large chunk of
Yes.
their day,
Yes.
really, we got to educate the teachers around
Right, and
this.
that's part of the job. My role is to do like professional development
Yeah.
for teachers to how to support a student who's grieving, and it's not pretending it didn't happen.
Yeah.
You know, which is sometimes people think is easy.
Yeah.
You know, they seem fine, so they're fine. It's acknowledging it. Even sometimes if they're able to give a little personal insight to maybe a time when they have had a loss. And with this role, it's bringing that grief education in.
Yeah.
So calling, me in to do some grief education and have it open up that dialogue.
Yeah, and I think it becomes more complicated, as you
Right.
say, because here you are, you're interfacing with people who are the teachers, and the people bring their own stuff to
They
the
do.
situation.
They do.
So what has it been like for them? How do they approach grief? So there's just another layer there, isn't there?
There is, and that's where the education is so important, and having it be a part of the curriculum, like English is and math, and it's part of the social emotional learning, because inevitably everyone is going to suffer a loss. And a recent statistic is 1 in 16 students in Massachusetts will have someone they loved who's died by the time they're 18.
That is scary.
So that's one
Think about
per
that.
classroom. That's
Right.
one per classroom.
So that is huge.
That's huge. That's huge.
So, I mean, it's just, for kids to be able to navigate this type of a thing, because,
Yes.
a loss is so significant.
Yep.
So what type of losses are you talking here?
Losses that we have seen is overdoses, unfortunately, sudden heart attacks, cancer,
Yep.
suicide.
So, and you're talking about losses of friends,
Friends, or a lot
Parents?
of parents.
Yeah.
Parents, yes.
grandparents.
Grandparents, yep.
So it could be a number of different people.
yes,
Siblings.
Siblings.
Yikes.
Yes.
Yeah. So.
Yep.
Yeah, it's, and I think the hard part too is that, grief is not always visible.
No.
So can you talk a little bit about
Yeah,
that?
I mean, being silent,
Yeah.
is a big thing for kids, and aggression is huge.
Yeah.
I'm fine. And it's, one important thing that we tell families is what happened when someone died is very sad. You can't say very enough, right? It's very, very, very sad. And oftentimes when we're sad, we cry, right?
Right.
But for a lot of adults, they don't want to cry in front of their children because we want to protect our children, right?
Yeah.
I can count on one hand how many times I've seen my dad cry, right?
Yeah.
So we encourage parents to cry in front of their kids, because oftentimes when we meet with children and we talk about how mom is coping, and we say, does mom cry? No, mom never cries. Mom never cries. And so we say, yes, mom cries. She's crying in the shower.
Right.
She's crying in the car.
Yes.
So by crying in front of your children, you're giving them permission
Right.
to then cry
Yes.
if they want to.
Yeah. So in our attempts to protect
Yes.
each other,
Yes.
we're actually modeling behavior that is,
Yep.
it's not really helpful
Yes.
for them.
Yes.
Yeah,
yes.
isn't it an interesting
I had a
thing?
conversation with a mom the other day, and her husband died, and her son is 3, and he only knew his dad sick, and they were in the car, and he said to her, Mom, are you sad? Do you miss Dad? And she said, yes, I'm very sad, and I miss Dad a lot. How about you? And he said, I miss Dad, but I'm not sad. I just got a new toy. So
yeah.
it's, But the mom modeled, yes, I am
Sure,
sad.
yes.
I am sad. And
Well, and that's hard for a parent to hear,
Yes,
isn't it? Because the
yes.
grief is so pronounced, and then when you're hearing that,
Yeah.
but it's just so age appropriate.
age appropriate,
See, and I
age
think that's
appropriate.
helpful that parents understand
Yes.
too, because otherwise we can make gross assumptions for each other,
Yes,
right?
yes.
Is that if somebody's not crying, they're not grieving.
yes.
And like you
not-
say, it's so different for kids, and that they can almost isolate affect.
Absolutely. And it necessarily is not happen right when the death occurs. It could happen later on, months. We talk a lot about grief triggers, at least expects you. In the grocery store, grocery shopping, and realizing you no longer have to buy Frosted Flakes
Right,
because the person who eats the Frosted Flakes has died.
right.
And then you're crying in the middle of the grocery store.
Sure.
Yeah. Because there's no textbook. There's no, and that grief is very messy.
Yeah,
it's very messy.
Well, just the grief ambushes, right?
Yes.
When you think you're doing okay, and I think that's the hard part too for kids in the school system is that people outwardly can observe and say, oh, look at them, they're over there with their friends, they're laughing, they're this, they're not grieving.
No, they're doing fine. They're doing fine.
Yeah.
I mean, that's a big.
Yeah, but yet the kid goes home and they lock themselves in the room for the rest of the night, and they're just not even able to get out.
Exactly. Yes. And, and parents of children who have a friend who has, someone who's died, it's helping them be aware is acknowledge it. Yeah. Ask your friend how they're doing. Do you want to talk? Do you want me to talk? Do you want to talk about your dad?
Yes.
Do you not want to talk about your dad? Not have it be that elephant in the room.
Yeah. And I think, it's our own anxieties and our own discomfort around having these conversations. Because what do we say to people? Don't cry.
Right.
Right. When I always say to people, cry as much as you need to.
Exactly.
But there's that modeling that you're talking about. Because really what you were talking about just a few minutes ago with the parent, really being able to, parents are so protective, though.
They
are.
In
their attempt, again, to shield and to not appear, because that's the other thing, right? Because the kids are afraid. So it must be that, geez, if mom's crying, she's not going to be able to take care of me.
Right.
Do you see a lot of that?
And a big fear for kids who have had, especially a parent who's died, it's fear that the other parent is going to die.
Yeah.
Because they have had one parent who's died. Who's to say another parent can't die? Yeah. So a common thing for the surviving parent to say, I'm going to be fine. I'm going to live forever. I'm going to live forever. And hopefully that you're going to live a very long time.
Right.
But it's acknowledging that this is a fear.
Right.
And what do we do about that fear?
Yes.
And, one way to do it is to explain to your children that, just like you go to the doctors for a checkup, I go to the doctors as well. Because I know I go to the doctors when my kids are at school, so they don't know.
Right.
And that as of right now, the doctor says I'm healthy.
Yes.
If something were to happen to me, this is who you would go live with.
Yeah.
You'll go live with Aunt Julie and Uncle Dan.
Yeah.
And oftentimes, the known is a lot better than the unknown.
Right.
But it's so hard for parents to have that conversation.
Sure.
But if they're asking, they want to know.
Oh, absolutely.
That's, I can't say that enough.
So how do you dole out that information? Because, again, is that different in terms of children?
Absolutely.
Can we give too much?
Yes.
Can we give too little?
Yes. So think of it as when you give a child, ibuprofen if they are sick. You would give a 4-year-old a different dose than you'd give a teenager. And that's the same way with information. Okay. Less is more.
Yep.
If they come back to you with more questions, you answer, a little bit more.
Yeah.
You take their lead.
Yeah. So, because it's interesting, even with small kids, right? Like they ask a question and then we start getting into this big dissertation.
Well, right. They're like, goes right over their heads. Right.
It's like, I just needed to know if, so and we just give way too much.
We gave way
and it's totally over their head.
It's totally over their head, yeah.
So paying attention for the cues, right? Yes. Keeping it simple.
If they ask, they want to know.
Okay.
They want an answer if they ask.
Yeah, and like I said, that modeling behavior must be a really big picture.
It is, and that's where we can help with the grief support. Modeling that for families when they have individual counseling or in the Raising Grieving Children's group, and modeling for teachers as well.
Sure.
A little bit of language to say if a first grader comes up to their teacher and says, "I really miss my dad," stops a teacher in their tracks, but.
Yeah,
the student needs a little bit more.
Okay, Johnny, get on to biology, right? No, we don't want to do that. It's like, so really being able to be with the child in the moment.
Yes,
and,
yeah,
it's
an acknowledgement. It's they want to be acknowledged.
Yeah, absolutely.
Yep.
Yeah, and just I think sometimes again we get so uncomfortable with the expression of emotion. And I think people think that it's a weakness, and for parents we got to remain strong in front of our kids. So, but crying is a strength.
Crying is a strength.
Right. And also to reassure the kids, I bet to that again I'm not crumbling.
Right. Exactly. And we're going to be okay.
Yeah.
This is hard. Yeah. This is hard. Mom's very sad, and Mom's going to have her moments where I'm very sad, but we're going to be okay.
And then I'm here to take care of you. Yeah,
yes.
I think there's just the real primitive stuff that goes on, right? Just to the basic core of us in terms of who's going to take care of me.
Right.
When you're doing this work, because this is a process, isn't it?
It is.
I mean, my gosh, it's like unpeeling an onion.
Yes.
Yeah. So do you, what kinds of things do you feel like around helping, again, let's go back to the teachers for a minute, because like you say, now you're dealing with a multitude of people who have had their own different experiences. What other types of things do you want to talk to the teachers about in terms of how to approach kids and doing things like that?
It's, having them, the biggest thing is really having the kids have that space if they want to talk about it, to watch out for the behaviors that are coming up. They may see a decline in their academic grades, and that's okay. It may be temporary, it may not. And maybe looking around to see if there is another student who has experienced a loss as well, and they can get them together. It's really taking the child's cue, not forcing anything on them, like you must go talk to the guidance counselor, you must letting them know guidance is there if you do want to talk to them, because
it's almost like a punishment,
right?
It's like, oh my gosh, I'm grieving, so I'm going to get sent down to somebody's office.
Exactly, and knowing that it's there if they want it. And not announcing it to the class if the child doesn't want it announced to the class. Really giving the child, no matter what age, the respect of what their wishes are, and consistency though with the behavior. Because we recently had Camp Stepping Stones, which was a fabulous success.
So tell you a little bit about that.
So Camp Stepping Stones is a grief and healing camp for children and their families who have suffered a loss. It could be a parent, grandparent, sibling, relative, anyone. It's a one-day camp. And the kids are split up into groups based on their age. And they do memory-making activities. They do regular rock wall climbing. They do a really cool heart puzzle. They each get a piece of a wooden heart, and the heart is put together at the end of the day, which is really neat. And then the adults are in workshops themselves. So we have a guest speaker, Paul Thayer. He's from BU, Wheelock College Child Life, and he does a talk every year on raising grieving children. And one of the things he says is the only thing worse than a grieving child is a spoiled child. Oh, wow. So oftentimes, when a loss happens, parents, teachers, let the behavior slide a little bit. The disrespect comes out because they're grieving. And yes, they are grieving. However, they need to, kids crave that structure and they crave that predictability. So if mom wants me home at 10 every night and now that dad died, I'm allowed to come home at midnight. Maybe once or twice that's cool. But after that, I'm looking for mom to say, no, back to 10 o'clock. And the same with school as well.
Well, that makes sense, doesn't it? Because again, you think you're doing the kid a favor by doing this, and then basically that tells me that things are coming apart. Right. Where kids want more than anything, even if they don't act like they do. They want that, they want that predictability, and they want mom to be mom. And whether that's cooking dinner every night or and getting takeout for a while is okay, but they want mom back to cook dinner and taking out the trash and all that. Well, just that too. I mean, there's so many secondary losses. I'm thinking about but dad used to take out the trash. Right? So the secondary losses that is experienced for the children and all of that, talk a little bit about that for us.
And they're often things that we don't necessarily predict, like taking out the trash. A 15-year-old who turns 16, time to take driver's ed. Dad was supposed to take me to driver's ed. And then, they could have been taking a few steps forward with their grief. They take a few steps back now. Prom. My mom's not there to do my hair for the prom. Baseball starting up,
These big events that just make that grief come rushing back.
They do, you do. And oftentimes not for a long period of time, but it's almost like it needs to be acknowledged. And, and then, take a step forward. What would you suggest? Because, people say the darndest things when people are grieving, don't they? And all well intended. Absolutely. But wow, it can be just not very helpful, though, right? We could write a book with things kids say that people say. Yes. So
Tell me, what would you give some advice to people on what they should be saying to people who are grieving?
It's less is more. That's my thing. You know, I'm here for you.
Yep.
I'm here for you. You know, I'm sorry about your dad.
Yeah.
Acknowledgement.
Yeah.
And then taking the person's cue.
Yeah.
Whether they want to go more, you know, into it. And really taking a step back and asking yourself, am I asking what I'm asking for my own curiosity, or is it, you know, for to help them?
Right.
You know, because people, even kids, get tired of telling the story. You know, even though telling the story is important, they want to tell the story when they want to tell the story.
Yeah.
You know, on their own. So when 5 kids are running up asking the same, you know, is to really take a step back and you know, ask yourself, why am I asking this? Why am I, you know, and that goes for adults too, asking other adults.
And not out of nosiness, but out of genuine concern.
Right.
Yeah, and there's a difference. And
there
people
is
know
a
it,
difference,
huh?
right.
And people know it at any level, don't they?
They do. They do.
They can just, they can sense really genuineness, they can, authenticity. Even children do that, don't they?
Yes, and I think it's important, the acknowledgement is huge, you know. You know, it's like that elephant in the room.
Oh, it sure
you know,
is.
I'm sorry about your dad.
Yeah. And I think that is, I mean, people say, you know, they try to help and they'll say things like, you know, you'll get over it. That's the thing. Those things are not helpful.
Yes. No, not at all. Or you know, I can tell you a story.
Yeah, I'm sure. Well, you know, I'll tell you, we could go on, Kristin, but I know we have to wrap up here. But, you know, tell people, please, how they can get a hold of you.
To call the Burton Center for Grief and Healing, and you can ask for.
Here's the number up now. We have it on the screen.
Okay.
But to give you, they can call the Burton
Yep,
Center.
and you'll speak to the bereavement associate, Carrie Ann,
Okay.
and she will then transfer to the appropriate person, whether it's me for the school support or the other child life specialists.
Excellent.
Yeah.
And then, you know, also, you know, I'd love to have you back on the show because there's a lot of other things I'd love to talk about with you on this topic. But so maybe a part 2 is in our future if you would be willing to do that.
Yeah.
You know, and also for the audience, if people have questions, please feel free to call Care Dimensions.
Absolutely.
And you can do that. But I want to thank you so much for being on the show and talking about this very important topic.
I could talk about it for days.
Good. Well, again, part 2 is definitely in our future. Thank you so much for your time. And thank you for tuning in to Timing is Everything, and we look forward to you tuning back into the show next time.
Formerly Hospice of the North Shore in Greater Boston is different in that we do more than just hospice.
It's just incredible, the services they provide when people need it the most.
So being able to offer more individualized care helps people feel more cared for.
Because it's about the patient's quality of life.
I don't think there's any place else in the Boston area like Care Dimensions.
At Care Dimensions, we'll take care of your family like you're a part of ours. Visit us at caredimensions.org.